It's crazy to me when I imagine the amount of people that could be living with and struggling with what I call stubborn dry eyes without resolution. Now, if this sounds like you and you think you've tried everything out there may be one simple thing that you haven't yet checked out that you absolutely must. Now, in my experience, almost everyone in this situation hasn't done this yet, and it's understandable because you may never know without a little help. Welcome back. If it's your first time here, I'm optometrist Martin Aguzi, and I make eye knowledge videos to help you see better, see more comfortably, and to keep your eyes precious. Now remember, the best way to make sure you get notified every time I release a new video is to hit subscribe, followed by the notification bell as well. Now, once I had a patient that had struggled for years with sore, blurry pink eyes every morning. That got a little bit better as the day went on, but she had tried every drop out there seemingly, and while they had helped a little bit, it was always the same problem the following morning. Now, having a suspicion about what I thought was going on, I asked her to check out one little thing that night and report back after following some remedial advice. A week later, she was delighted to report that on every metric, her eyes were now significantly better and were still improving. So what happened? It was all down to a condition called Lagophthalmos, a lesser known and often forgotten consideration by even us eye care professionals sometimes when assessing and managing patients with dry eyes. So what is Lagophthalmos, and why is it the cause of dry eye misery that is so often forgotten, you might be thinking? Well, simply put, Lagophthalmos is a medical term for the inability to close one or both eyelids completely. In Lagophthalmos, there is essentially a lag in either the top or the bottom eyelid, leading to them not meeting together fully. Now, this will of course cause huge problems at night when our eyes are supposed to be closed, but they end up being partially open instead. Now, the issue here is probably obvious to many, but the exposed eye surface becomes acutely dry as the tear film evaporates, and this causes spots of micro damage on the corneal surface, which in turn triggers inflammation on the eye surface. Now, in the morning, the result would be effectively that the eye may then become stuck together from the tear film mucus layer that may be left behind when the watery layer evaporates, as well as causing soreness, redness, and blurriness of the eyes. Now, thankfully, during the day, when normal blinking and tear coverage returns, the eye starts to recover somewhat. However, the longer this goes on, the sufferer may find that conventional ocular lubricants and dry eye management strategies may stop being effective until something like steroid treatment is used to manage the inflammation. Now, Lagophthalmos can occur due to several reasons, including problems to the nerve supply for the eyelids, trauma, or even secondary to surgical complications. There are about 4 types of Lagophthalmos, and we'll cover them now. So the first is called paralytic Lagophthalmos, and this is caused by facial nerve damage, often seen in conditions like Bell's palsy. Secondly is mechanical Lagophthalmos, which results from structural issues of the eyelid, such as when you remove sections of the eyelids due to suspicious lesions, for example, that we might think may be cancerous. Cicatricial Lagophthalmos is associated with scarring of the eyelids due to burns or autoimmune conditions. And finally, there is nocturnal Lagophthalmos, where the eyes close normally when awake, but not when you're sleeping. Now, in many cases, as eye care professionals, we expect Lagophthalmos to be one of the first 3 types that are visible in the day, and as a result, we may overlook the hidden cause of many dry eye sufferers' actual problems, nocturnal Lagophthalmos, which isn't noticeable in the daytime. The other reasons that Lagophthalmos goes undetected for many years sometimes is likely because sufferers obviously can't observe or view their own eyes each night, and professionals can't necessarily tell apart the difference between a nocturnal Lagophthalmos caused dry eye and other causes of dry eye. Now, diagnosis typically involves the following things. We take a detailed patient history discussing any recent traumas, surgery, or medical conditions that an individual may have, and this can give clues to what's going on. There's also the physical examination, where an eye care professional will assess eyelid function and measure any gaps when the eyes are closed, and this can be done in practice if we suspect that there may be an issue with lagophthalmos. Sleep observations. If it's practical, you'd be asked to get a loved one to watch you while you're sleeping to try and detect any eyelid closure problems. And here are two non-surgical solutions for nocturnal lagophthalmos. Firstly, nighttime specific lubricant eye drops or ointments can be used, and they can create a barrier effect that prevents exposure of the eye surface to the air at night. And this can be followed up with intensive use of preservative-free sodium hyaluronate-based artificial eye drops throughout the day until your symptoms improve. I'll link in the description box below some examples if that's helpful to you. Secondly, taping the eyelids can be an effective way of dealing with nocturnal lagophthalmos, and taping the eyelids shut using surgical tape can prevent exposure and dryness at night. Now, the misery caused by dry eyes is no joke to many, and we know that it can unfortunately lead to complications that are significant if untreated. If you've been living with the misery of stubborn dry eyes for a significant time, you really have nothing to lose by looking at the possibility of whether you may have nocturnal lagophthalmos. Raise the discussion with your eye care professional for help with evaluating any treatment options that may be necessary. Now, I'd really love to hear from you guys, so let me know in the comment section below whether you can relate to this topic of lagophthalmos or stubborn dry eyes, and how you've been getting on with it, and any kind of treatment secrets that you've discovered along the way. Thanks so much for watching. Please do subscribe to the channel if you got value from it, and also liking and sharing this video really helps us out, and also lets me know that this video was of value and to continue to make similar topics on the channel. Do check out the links in the description box for references and resources, including my other video playlists on dry eyes.